还是要继续回到疫情相关的话题。在过去几天呢，有关于中国突然放开清零之后可能会出现什么样的趋势，那么我呢也是采访到了几位专家，其中呢有的呢是在北京当地的驻华记者，他呢为我介绍了现在他所了解到的身边的人对于突然放开清零之后的反应，以及中国的一些药店等等出现医疗挤兑的状况。但是 Eric 也特别关注到中国医疗挤兑的情况，能不能简单给我们介绍一下你所了解的情况？
我只是做了一个简单的计算，前段时间中国的专业人士出来讲，在1个月之内，包括张文宏医生，他讲1个月之内达到高峰。那达到高峰呢，他说是要60%的人被感染。好，我们做个简单的计算，60%的人达到高峰14亿乘以60%。那么这个 Omicron， 导播可以给我们放一下那个 Omicron 在加拿大的一个数据，因为这个数据的话，确实是不是很这个数据在最底下，就是达到重症的 Omicron 达到重症的比例大概是0.就需要住院的是0.3%，需要去 ICU 的是0.1%，那你就3个数字乘一下咯，14亿乘以60%乘以这个0.1%。最后我得出来的结论是就是84万人，84万人在1个月之内要进 ICU。中国一共有多少 ICU 的病床呢？6到7万，最多就是不到7万，6万多病床。84万人怎么去在1个月之内要去6万张病床的这个医疗资源就会明显不够，所以这个是我比较担心的。而且我说实在的，我不太支持就是突然的全部放开，应该是逐步的放开，把这个高峰避开，不要一上来1个月之内60%人感染，这个对于医疗资源的这个负荷来讲实在是太重了。这是我的一个观察。
对，的确啊。那我们在网上也看到很多图片，这个医院里面挤得水泄不通啊。当时我就很惊讶，我说怎么这突然这么多人都要去医院呢？实际还有另外一个原因是什么呢？就是这个大家呢其实稍微有一点发烧感冒，本来呢是可以去这个药房买点药就可以了。现在药房的药全被大家抢空了，大家都囤着怕出事儿。结果没有办法，有发烧大家要去医院了。那我们看到这个医院的发热门诊啊，挤得水泄不通。实际上呢，也是对于医院本来就有限资源的一些浪费。那现在我们看到啊，是出台了这样的一些政策上的补助。那比如说在小区门口增一些发药点，确保大家呢人人手上有2盒这种一般性的普通退烧药啊，有一点这个喉咙的这样的一些药啊，那么呢大家就不要没事往医院跑了。这个呢，我觉得是相对来讲比较正确的举动。但是呢，我在采访到这一位驻华记者的时候呢，他也特别问及身边的人啊，说其实身边的人的看法也有很多的不同，有一些看法觉得是难以置信。怎么突然说我们动态清零是伟大胜利，现在突然一下就不清零了，就阴阳尽阳了？也有人呢觉得是一种解脱，封了3年终于可以出去了。还有一些人，更多的一些人觉得是焦虑，就是不知道到底未来会怎么样啊。那么3类人都有。现在呢，这些政策其实我比较同意 Eric 的做法，就是说吧，这个转向是没错的，但是你突然一个急转弯，你车上的人全吐了，这不行。你呢得给大家心理预期，转弯之前得先打灯，不打灯这实在是说不过去啊。在今天早些时候呢，我也采访到了另外一位兰德公司的专家叫做黄志环教授。黄志环教授呢，现在是乔治城大学国际公共卫生领域的专家系主任。那我向他呢提问，主要是有几个方面。第一我们听说中国开放之后可能会有死亡，死亡到底是死亡多少？现在科学界对于这个问题到底是怎么认知的？另外呢，就是有关于现在大家网络流传的一些什么莲花清瘟这样的一些中成药到底有没有效果？还有呢，就是有关于之前大家所说的普遍预计的病毒学家特别关注到的问题，就中国开放之后，在这样一个广泛的人口这么密集的一个国家传播，出现新的变种可能性到底有多大？那么在今天节目的最后呢，我们就为大家播放采访中的一些片段。如果大家呢对于这档节目感兴趣的话呢，我在另外的合作频道叫做中国项目的 China Project 基本呢每周都会做这样的一些英文的专访时间都比较短，基本是10到15分钟，主要是采访政策、学业以及商业界的有关于中国问题的特别的专家和学者。那么每期节目呢，我们都配有中文字幕，如果您喜欢的话呢，也欢迎你移师与我们合作的 The China Project 项目来看一看这些采访中的内容。好了，下面就请导播放上这一段采访内容。今天华尔街论坛就与您再见。
大声。
Beijing's abrupt relaxation of pandemic controls really surprised many experts I talked to. What do you think are the reasons behind Beijing's sudden change in direction?
Yeah, well, as an epidemiologist, I usually think of any epidemic or pandemic through this triad framework. So it's the agent, that's the virus, the host, that's the susceptible population, and of course the environment. I think in this case, the critical factor is the virus, because the Omicron variant is so transmissible. So even though the dynamic zero COVID policy worked for the Alpha and the original strain, Alpha and Delta, it really cannot stop the spread of the Omicron. And of course, if we use very strict the NPI, the non-pharmaceutical intervention, that's including lockdown and other effects, that also cause a lot of suffering, social suffering, as well as smothering the growth of the economy and technology and so on.
Right. And epidemiologists are quite concerned with China's relatively low vaccination rates, especially among the elderly, as well as the imbalance of its medical resources. Are these concerns still valid now? What can the government do to mitigate the risk of unleashing another deadly wave of infection later this year?
Yes. Again, back to the triad model, if the virus becomes stronger, then the idea is that you need to increase the immunity of the susceptible population or change the environment, right? So the one way to increase the immunity of the population, of course, is a natural infection. But the other one, much safer one, is the vaccine. So we have seen that at least the data to this March in the spring in China, the most vulnerable population, that's the elders, that's over 60 years old, over 65-year-old, especially those who are over 80 years old, their vaccination rate is still pretty low. I think especially the booster rate is extremely low. And we have seen that for vaccine, the China's vaccine are pretty good, but it seems the immunity come down pretty fast. So only when people get a booster, then they can get a similar protection as other vaccines. So that's very concerning. So the vaccine rate, the low vaccine rate among the elders is the most critical problem now.
Right. And of course, the real question is how many severe cases and COVID-related deaths there will be, not just the case number itself. What is the best research on this front? I've heard, multiple estimates that are not exactly consistent with each other. What's the ballpark number of, potential death?
Yeah, so that's always a difficult part, right, for prediction, especially with a pandemic that's the determinants, it's multi factors. So it's hard to bring all these moving parts together to give a good estimation. I would say the modeling nowadays, I think if anything, the mathematical modeling with disease, the understanding of the disease now probably is the best bet that can bring all different factors together. So in July on the Nature Medicine, there's an article coming out of the Fudan University. I found that's a really nice, really good study. And it predicted that based on the Shanghai wave epidemic outbreak in the spring, based on those data and calibrate the model with that data, it shows probably there will be about 1.5 million deaths if it continues for another 6 months. So I think that's a very, very disappointing, of course, the problem. So that model is based on that there's no treatment and there's 5 million dosage booster per day, I think. So that's still causing this large scale of deaths. So I think the future is very severe. And yeah, I will stop here.
Right. Thank you so much. That's really helpful to know. Some virologists also worry that the virus will evolve into more dangerous variants as it spreads. For example, I saw Dr. Marine Koopmans just tweeted, another likely scenario is a massive wave in China spawning a range of new variants. I wonder if you can talk a little more about that possibility.
Yes, I do think that possibility is high. I'm an epidemiologist looking at a population, not a virologist. Although if you look at U.S. CDC's statistics about the variants, the COVID-19, this virus, really causing the generation is turnaround is very, very fast. Now, every couple of weeks we have a new variants, and they are competing with the old variants and finding the fittest one. I haven't seen that speed has slowing down. So I think the same thing will happen in China once the large epidemic is in the process. So the key to that is really the monitoring. China has the ability to do the genetic testing for the new variants. So, and it can share with the world. So I think the best defense would be for China to keep vigilant and for the world to encourage China to communicate for communications.
Fantastic. Finally, when it comes down to normal people, what should Chinese people do to better protect themselves and their family members?
I think based on the model and all the factor we have seen now, it's the biggest challenge is the healthcare system crash. So some of the models showing that maybe within 30 to 40 days that it will reach the limit of the healthcare system, especially the ICU units. And it's not that easy, that quick to build up the ICU. So it's really about how to look at the limited resources, and applying to the most significant way to reduce mortality and reduce the disease burden. So I think for citizens, it's really about understanding what is COVID symptoms, and to try to educate themselves about when to contact hospital, and especially to protect those vulnerable. That means those who have chronic diseases, obese, and also for those who also in the elders age group. So separating the people by age group within a household probably is important. And otherwise, using other NPIs can can postpone some of the hike, the spike of the infection. Yeah,
Great, that's super helpful. Another piece of controversial policy initiatives rolled out by the Chinese government is this dependence on Chinese traditional medicine, 莲花清瘟. Can you talk a little bit about sort of the effectiveness of those medicines relative to, say, cold remedies we use in the United States, say Tylenol? What's the best evidence on that front?
Well, Tylenol is really just to reduce fever and reduce the symptoms. It's not antiviral. In US, the most effective antiviral medicine are Paxlovid and Molnupiravir, and even some of the other earlier used antiviral can be effective. So that's actually another way, to reduce the mortality, is to use the antiviral as early as possible. I know Paxlovid is patented in China, but I haven't seen wide use of it. So that's also a concern. I don't know about the effectiveness of the 莲花清瘟, because I haven't seen a good clinical trial data on that, so it's hard to comment.